Welcome back to Falcon Physician Review's online review for USMLE Step 1. This is Microbiology Module 41, the Subcutaneous Mycoses. We're going to talk about sporotrichosis and we're talking about chromoblastomycosis, other infections caused by fungi which affect our deeper tissues including the lymph structures. Welcome back to Falcon Physician Review's online review for USMLE Step 1. This is Microbiology Module 41. And we'll be discussing the subcutaneous mycoses. This table is something you're going to want to commit to memory because it discusses each of the diseases caused by the subcutaneous mycoses, their etiologic agent, the symptoms, and the identification of the organism. Subcutaneous mycoses infect deeper epidermal tissues, including the dermis and the subcutaneous fat, muscle, and bone. It's often acquired by traumatic punctures. Sporotrichosis is also called rose gardener's disease. It's caused by Sporothrix schechnii. The symptoms include an erythematous, fluctuant nodule, and ulcer along the lymphatics from the site of the inoculation. So frequently you'll have a gardener gets pricked by the thorn of a rose, and at the site you have a pustule, and then you have erythematous lymphatics draining from there. On microscopy you'll see cigar-shaped budding yeasts in tissue exudate. The mold will have a daisy pattern of conidation on culture at 25 degrees. You'll also see asteroid bodies. That's a key word you're going to want to look for. For chromoblastomycosis, or chromomycosis, you worry about Fonseca species, Cladosporidium species, or Phyllophora species. Symptoms include warty nodules that progress to cauliflower-like lesions with the appearance at the site of the inoculation. Also, you'll see auto-inoculation, where you have somebody picking their wart, and they touch another part of their body that has a break in their skin, and then they'll get nodules there. Microscopy will reveal copper-colored spherical forms called medlar bodies in tissue. You'll also have intracellular copper penny forms. Lastly, you can have a fungal mycetoma, or a eumycetoma, which is a localized infection. This is caused by Pseudorelaricia boydii, Madurella grigia, or Madurella mycetomatis. The symptoms for this disease include draining a sinus tract at the site of inoculation. The lymphatics are not involved in fungal mycetomas, and they're species-specific granule colors. So what on microscopy you'll see is white, brown, yellow, or black granules in exudates that are fungal colonies. Here's a figure describing sporotrichosis. So we have here somebody who has a thorn with an ulcer on their pinky, and it's red and indurated, and they're getting blisters. The lower figure shows somebody's infected foot, and you can see the lymphatics are being marched down. And then on microscopy, you'll see these small branched budding yeast. Chromoblastomycoses is a fairly distinct clinical appearance. Look at these feet with these large nodular lesions. Microscopy will show the characteristic budding yeast form. A 26-year-old outdoor construction worker presented with a swollen foot and multiple warty cauliflower-like lesions. A biopsy shows copper-colored spherical forms called medlar bodies. The most likely diagnosis is, so if you have somebody who's describing a cauliflower-like lesion with copper-colored spherical forms called medlar bodies, you know you're talking about chromoblastomycoses. Hyphomycoses can occur at any body site, and they can be caused by any dematiaceous fungi. There, they have diverse symptoms with no specific element. Lymphatic involvement is possible, and they're often the term is reserved for miscellaneous subcutaneous mycoses other than chromoblastomycoses, mycetoma, or sporotrichosis. Question. A 35-year-old rose gardener presents with several subcutaneous erythematous, fluctuant nodules on his right hand. Which of the following organisms is most likely responsible for this condition? Fortunately for mycology, it's infrequent enough that the test questions are going to show up just like this. They simply want you to be able to remember the name of the organism and recognize the disease. This is rose gardener's disease. It's caused by Sporothrix schechnii. Wrapping up Module 41, we reviewed some of the subcutaneous mycoses. Those that are most clinically relevant include sporotrichosis. It's Sporothrix schechnii, it causes rose gardener's disease, and it's got a characteristic history of somebody who's been messing around with roses and gets pricked, and then they have a red lesion that goes up along their lymph nodes. We also talked about chromoblastomycosis, which is a disfiguring disease of the foot, and we also talked about the fungal mycetoma. Coming up, we'll talk about fungi that can infect us throughout our entire systems, or systemic fungal infections, in Module 42.